Most of us became physicians because we loved science. I happen to love people. So this was the perfect merger of my thirst for knowledge and my love of people. So most of us have great intentions. So we want to get to know you. We want to collect a very comprehensive history so we can protect you from any risk factors or disease that you may or may not be at risk for. So that's what all physicians want to do. I think what separates me from some other physicians is that I'm constantly reminding myself to treat my patients like family. And so for my family, I'm always going to want to not only heal when they need to be healed, so help you when you're sick, but I'm also going to want to prevent disease, to prevent illness. And so what we do at Family Medicine Austin that's special is we've teamed up with health grades so that you can have an extension to a traditional physical, which you can find anywhere, in the hopes that we will give you a healthier life, improve your quality, and protect you from mild, moderate, severe diseases that could hurt you in the long run. And I think that's what sets us apart. What I hope to do with making this extra testing available to my patients is to preserve not only the quantity of your life, but the quality. If I can find disease or abnormalities earlier, that means we treat them earlier and your life is of a higher quality. This does not take the place of a traditional physical. There's nothing that takes the place of that wonderful kind of one-on-one, but this is definitely an extension. And that's what we hope. We hope to give you more as part of your physical, ideally at no expense to you, but ultimately it's because of you. It's because you have a family and you have people that depend on you, and you and I don't have time to be sick. So if I can find mild, moderate, severe disease before you have symptoms, before you get sick, then it's a job well done. It should be part of everyone's physical because an ounce of prevention is a pound of cure. I definitely have favorite tests that Health Grades offers. Most of them are my favorites, but I'll pick a few that I think will help explain why I'm a believer. So number one, heart disease is still the #1 killer of most Americans in the country. If there is any way that I can prevent it in every patient that I see, it's a longer lifespan for that person and potentially life-saving, of course. So one of the two top tests that stand out to me are the echocardiogram of the heart. It's a 2D echo. Again, these are painless tests, non-invasive, so no radiation. Essentially, they put jelly on your chest and they take a picture of your heart. It's very simple. But that one test will tell me if your heart is enlarged, if it is weak, if it is abnormal, or if you have a mass where you're not supposed to have a mass. It's simple. It's evaluated by a cardiologist, and I get the report and I discuss it with the patient. So I think that is a pretty awesome test. It's an ultrasound. The second test would be an ankle brachial index, so ABI. Very interesting because the heart is not the only place that gets blocked. It's not the only place where you can have blockage of atherosclerosis. You can have blockage from your head to your toe. And an ankle brachial index will tell me whether or not the arteries, which is the end of your system, it's all the heart gets pumped through the whole body, are constricted. If they're narrower than they should be, which is not good. It is a potential sign of peripheral arterial disease, which essentially is blockage or narrowing of the rest of your body aside from your heart. So I think that's ingenious. Ultrasound, a little jelly on your feet, a little monitoring, and I get to find out whether or not there is potential possibility of you having arterial disease outside of your heart. Those two are probably the top two. I think a thyroid ultrasound is great. Healthgrades has found, and this is firsthand knowledge, in the last few months, we have, as Healthgrades, have found 5 thyroid cancers in patients that had no idea they had it. So life-saving, we remove it, we're done. There is no medical literature that says I'm supposed to even check your thyroid. Even if I were to, it's very easy to miss cancer. A thyroid ultrasound is not going to miss it. So again, life-saving, painless, it's one of my favorite tests. During a traditional physical, your family physician does a cursory eye exam, but we're not trained to look at the back of your eye, and so most people go to an optometrist. Classically, the optometrist will charge extra to do a comprehensive retinal exam, but Healthgrades makes it accessible to you. So a retinal exam allows us, as your primary care physician, to look clear to the back of your eye, which makes it comprehensive, and we can actually find early signs of diabetes and hypertension before you even know that it's an issue. I find that pretty incredible because the eyes are a window into the brain. And so if I'm able to find early signs, I can more aggressively look for things like prediabetes, treat this silent blood pressure that you didn't know you had more assertively, because it's the #1 risk factor for stroke. So one test ends up having so many implications. I think that's incredible. Spirometry is an interesting test. We love this test. It's just not convenient to offer in a primary care doctor's office. And so classically, it's only offered in a specialist office, like an asthma or pulmonology specialist. Asthma is a pretty chronic and pretty common condition in Austin, primarily because it's made worse by allergies. Between December and March, we have the highest pollen count of anywhere in the world. So allergies are a thing. They make a lot of people's lives miserable. If I can do a spirometry, which Healthgrades offers, I can tell you if you're at risk or if you already have asthma and treat it assertively, without having to send you to a specialist just to do the test. So I think the spirometry test offered by Healthgrades is a win-win for everyone with allergies, asthma, or who has the propensity for developing it. The easiest way to get this amazing preventive testing done is to see us at Family Medicine Austin. Most major insurance companies pay for a physical. So once we have spoken and completed the traditional physical, I order the Healthgrade preventive exams and set up an appointment for you, and you do your testing and return back to us to discuss all of your results. So for as rich as we are and as many resources as we have in this country, we should be doing better. We have access, we have intelligent physicians, we have the majority of Americans insured. That's one part of it, of a system that unfortunately is not working. The other part of it is you need a good physician, ideally a primary care doctor who was trained to not only take care of you and heal you when you need help, but also to prevent disease, to prevent illness. So if we have access and we have testing that's available to prevent disease, then those two roads should cross, and they usually don't. I think Healthgrades is the answer, and that is an extension to your traditional physical, and that's where I come in. Nothing takes the place of this relationship. I ask questions, I risk stratify you, figure out whether or not you have a history or a family history that puts you at risk, and then we go for it. We do safe, painless, preventive testing that can not only pick up things that are important, but potentially save your life. Preventive medicine is the best sort of medicine. It makes sense that most major insurance companies cover all of the tests that we've talked about, health grades. It's entirely possible that they will cover most of it, if not all of the fees associated with this testing. What could be better? I did a little research, and there are executive physicals with the same sorts of testing that are offered with us: heart, lung, thyroid. Those tests can cost upwards of $5,000 to $10,000. Health grades doesn't discriminate, and someone without insurance can still get this testing for less than the cost of 1 month family premium. So life-saving, preventive, and I believe affordable.